everyone, welcome. Happy Friday. Hope you're all doing well. I hope everybody had a great week and is looking forward to a nice weekend. I'm Dr. Amanda. Welcome to Let's Talk Health. If you're new here, then thanks for watching and thanks for joining us this week. As you can tell by the title of the video, we're going to be chatting about arthritis and pain and natural ways to help reduce your pain and reduce arthritis symptoms. But before we start, I just kind of want to check in with everybody and see how you're doing. How's your week been? I know here in Ontario, a lot of things are now changing, so things are reopening. So I kind of just want to check in with you all and see how have you been doing? Have you been going out and doing new things? Gyms have started opening, so let me know in the chat. Is that something that you've been doing? Are you going back to your gym or back to your exercise routine? Maybe you're doing outdoor workouts or taking things in a different new way. Or maybe you're still doing workouts at home. Maybe you're not doing anything at all, but let me know in the chat. I know that a lot of people that I've either seen in practice or just friends and family, they've told me that they really miss that the gym as an outlet and going to the gym just to kind of help with reducing stress or taking their mind off things, having a break. So let me know, is that something that you've been missing too, and are you kind of implementing that back into your routine? Personally, I haven't gone back to the gym. I'm just kind of doing outside workouts, so whether that be running or working out at home, which I haven't done too much recently. Mostly I enjoy running when it gets nice and the weather's nice outside. But maybe I'll think about going back to the gym or doing something like that. But yeah, it's kind of a great opportunity for us to talk about this and see how your routine's been and any change in that. Also, it's kind of a nice segue into arthritis and pain, because if you are going back to the gym, just be careful, because maybe you've been out of your typical routine for a while. You want to be careful with how much weight you're doing and the type of exercises you're doing. If you haven't gone to the gym for a while, then you might not be able to get back into that same regime that you had before. So just be careful with what you're doing. So let's see what people are saying in the chat. So people are saying, hi. Thanks so much for talking about arthritis this week. Yes, it was your suggestion last week, so you're very welcome. No change in status, still eating pizza and cookies every day. Pizza cookie. Yeah, so that's okay. I enjoy having pizza and cookies too. So we all have to enjoy our food. I will be talking a bit about diet today, but we all, there's foods that we like eating, and of course we want majority of our diet to be a good healthy diet full of lots of fruits and vegetables, but we can enjoy other foods too. I had a good week, went to backyard lunch at my work friend's house. Amazing, that sounds so nice. Feel more free now. Yep, so a lot of us are having that feeling of being a bit more free, being able to do some things that maybe we weren't able to do before because things are now opening, so that's great. I should go back to the gym, but I'm continuing to work out downstairs in my home gym. Yeah, so that's great. So whatever works for you. So like I said, if you enjoy going to the gym, a lot of people were missing that. So if you're able to do that, if you feel comfortable doing that, then that's great. But just of course, be careful. Start your routine back slowly. We all get really excited when we start a workout routine. So just start it off slowly. And I did post a video maybe a few weeks ago about how to start working out. So that one might be a good one to check out if you're interested in getting back to the gym, or if you're interested in starting an outdoor routine or a different workout. Okay. Well, I'm glad everybody had a great week. And I hope that, you continue to have a great weekend. So like I said today, I'm going to be talking about arthritis and pain, kind of some natural remedies to help decrease pain and arthritis. A lot of things are going to be anti-inflammatory, because that when there's inflammation, there's pain and there's swelling. So you'll hear me talking about inflammation and anti-inflammatory a lot today. So that's kind of what we'll be talking about. Yeah, it's 10 things. Those are my top 10 things. Doesn't mean, they're necessarily everybody else's, but this is what I find works and what's helpful. So yeah, let's dive into that. And if you're new here and you haven't subscribed already, then just you can subscribe to the channel, and then you'll get notified every time I go live if you click the notification bell. And then you get to join our community and get to join us every week and chat about different things. And you can give this video a big thumbs up. It helps to get with the YouTube algorithm and getting things noticed across all of YouTube. Okay, so this week I'm gonna give you guys a little visual, so I'll show you it right now. So I hope you can all see that. Let me know if you can see it. So it's basically a little visual that will have the 10 things listed. Movement, anti-inflammatory diet, fish oil, ginger, turmeric, boswellia, bromelain, magnesium, topicals, and then physical therapy. So those are the 10 things that I'm going to be chatting about, and I thought that would be helpful, and some people have also given me feedback to say maybe have a little visual, so let me know if that's helpful. That way you can have it all written down and you can see it. If it's the sizing is good, or let me know. Okay, so let's see. All right. So first things first, how about we talk a little bit about what osteoarthritis is, or what arthritis is. So there's different types of arthritis, but I'm going to be talking about osteoarthritis today. And that one is that like wear and tear on the joints, and it's a degenerative disease. So it basically, as you get older, it progresses and then it can get worse. So it's like we have so many different joints in our body. We have our knee joints, our hip joints, our shoulder joints. Those are the bigger ones. And then even just like wrist and hands and fingers. Those are kind of the more common ones that we develop arthritis in. And then of course we have our spine. So our spine is all our spinal segments, and then in between them we have our discs. And then there can be arthritis in between that. When we get degeneration of the disc, they get smaller. Then the vertebrae might come a bit closer together. You might get some wear and tear on them, and then you can have aches and pains and inflammation and all that fun stuff. So that's kind of what arthritis is. And there's different types. Like I said, there's also rheumatoid arthritis, which is more of an autoimmune condition, can still affect the joints. Those are the two main ones, but I'll be talking about the osteoarthritis today specifically, and how we can help to reduce pain there. Okay, so somebody's mentioning that it's good to have the list up there. Okay, great, I'm glad that's helpful. Will bromelain turn me into Brawly from Dragon Ball Z? Krill oil equals krillin? No, I don't think so. But we'll talk about bromelain a little bit. Okay, so first, you want to kind of figure out, is it osteoarthritis? Is it rheumatoid arthritis? Is it like a muscle sprain? Is it a ligament tear? Is it a tendon issue? Is it a muscular issue? Kind of, you want to figure out what's going on. But if you know you have arthritis, then of course that's fine. But if you don't, then you need to get imaging done. Usually that's what's done in order to figure it out. And then also you can kind of go based on symptoms. So if you have that like joint stiffness, if you have that decreased range of motion, if there's some swelling, if there's cracking of, that cracking, crepitus movement it's called, that noise, that would be kind of some symptoms of arthritis or osteoarthritis. But yes, do the imaging, and then that way you can know exactly what it is. Okay. So once you figure things out, then you can do different ways in order to work on it. But let's talk about number one here. So number one is movement. And you might think this is kind of a silly thing to talk about, because if you have arthritis, then you have pain and you might not want to move. However, low impact movement is actually very helpful. And by low impact, I mean things that are less impact on the joints. So you still are going to be moving, but you don't want anything that's too strenuous. So things like swimming is actually a really, really good one. It's been studied a lot for arthritis, for helping to reduce pain and reduce swelling, and helping in order to keep the joints mobile with limited amount of impact and like less wear and tear on the joints. And that's because of the water. It helps like keep it that buoyancy, but then it also provides a little bit of resistance because of, you know, the waves and the current of the water. It does provide resistance. So something like water aerobics is a great form of exercise to do if you have arthritis, or just in general too. So that's water aerobics. Swimming is a great one to do. Then there would be other things, things like cycling. So cycling is also lower impact. That could be, you know, going to a spinning class. That could be cycling on the street. Again, because you're sitting on the bike and then you're moving and pedaling, you're not really putting as much impact on the joints as if, like, let's say you were running, and then it's still a good cardiovascular exercise. Another thing would be like walking. Walking is another one. That's also very helpful for just having a light form of exercise, low impact. So in terms of cardiovascular exercise, those three I'd say would be good ones to do. But then you always want to make sure you're doing strength training or weight training. So weight training is really important because it puts some impact on our muscles and on our bones, and that helps build them. That helps with the strength. But again, it's not like like the high intensity impact that I'm talking about. I'm saying avoiding things like high intensity interval training, like where you have a lot of jumping or a lot of bouncing and movement. Those ones you want to try to avoid. Do like stationary weights, and that's really good for helping to build bones and helping for bone strength. So whether that be doing squats, you can do body weighted exercises if you can't physically hold extra weight. So body weighted squats, or even things like bicep curls, or like the rowing and the pulling, all those kind of things. You know, even shoulder movements, shoulder exercises, hip exercises. Those are all helpful for building up strength and building up muscle, and of course muscle is important for our bone health too. So I would say definitely incorporating some weight training is really important for your bone health and helping to prevent fractures, helping to prevent worsening of osteoarthritis too. Okay, so we've talked a little bit about some cardiovascular, some weight training, and then again with weight training, something important to note is making sure you have proper form and proper weight. So you might need to work with a trainer or somebody that's really skilled in knowing proper form, because so many times we could be doing something and we can be doing it in the wrong form, and then you can actually hurt yourself or give yourself an injury. Or you might be doing too much weight and you might not be doing it properly. So of course, making sure that you are doing it properly, starting off with a lower weight, and making sure you're having proper form is really important. Okay, then some other great things are yoga and Tai Chi. So these are both things that help to calm down the nervous system, but they also are really important for helping it stretching and lengthening the muscles, and helping to really activate that parasympathetic nervous system too. So that's important because it can help with flexibility, and it can help with muscle toning as well. And again, they're low impact. So whenever, if you are very stiff, if you don't stretch, then that can also make you more prone to injuries too. So having flexibility, stretching out your muscles is also important for arthritis and helping to reduce pain, and giving yourself a gentle form of movement. So I'm gonna post a link in the chat from Healthline with a few poses for osteoarthritis. They're very basic poses that you can look at, and you can do some of them. They're more of like stationary stretching poses, and they can be good for anybody, even if you don't have arthritis. So anybody that's listening that doesn't have arthritis, that's still interested in improving their muscle health and overall, flexibility. Those are some good poses to do. Yeah. So, okay. Again, and then everything that I've talked about, make sure you're doing it within pain tolerance. You don't want to be doing any of these and making it worse. So if you are already in a lot of pain, if your arthritis is really bad and you can't do any of these, then that's okay. Maybe you need to get your symptoms a little bit under control, and then you can start doing some movement. But always gentle movement is the best. We don't want to be completely inactive, and then that can also make things worse, because if you're stationary, you're not moving your joints, if they're not nice and what's it called, elasticity, if there's no elasticity or flexibility, then that's also not good too. So that would be number 1, is movement. If you have any questions about that, let me know. I'm going to jump into the chats and see what we have. So I did find my joints can't take the jumping. Yes. So that is what I was talking about, how to avoid the high impact. If you have arthritis, do not do things like jumping, box jumping, even like running can be too much on the joints, so avoiding those. Water aerobics is a good idea. Yeah, so that's really, really highly studied one to help with arthritis and pain. Walking hurts my back. Is there shoes that can help? So you might need to look into getting orthotics potentially, or looking to get proper, like, good supportive running shoes. So yes, maybe looking into that. If your back is hurting, maybe there's an issue with your hip, maybe it's your knee, maybe it's your ankle. So whenever you're going to get assessed by a physical therapist, they should be looking at all the joints, because potentially it could be somewhere else that it's stemming from if it's not actually from the back. So those are some tips for that. All right. Number 2 is, as you can see, an anti-inflammatory diet. And of course, I couldn't have a show without talking about diet, because it is so important. It really is the foundation of our health, and that fuel to really help us thrive and provide our bodies with energy, and that fuel to just keep going. So, we were talking at the beginning about pizza and cookies, which is fine, but majority of your diet, you should have an anti-inflammatory diet. You should have it filled with lots of fruits and vegetables. So this includes, your leafy green vegetables, other vegetables like tomatoes, green beans, cucumbers. You can even have sweet potatoes, different types of legumes, spinach, arugula, all those things that we've talked about before. Lots of fruits, so lots of colorful fruits, like your berries, they have lots of antioxidants, papaya, mango, apples, oranges, many different colorful fruits. That means that they have more a variety of nutrients and more of a variety of minerals and vitamins, more phytochemicals, and all of those help to reduce inflammation in the body. So really, if you're going to do anything, just add more of that into your diet. So if you're going to be having your pizza, then having something with that too. So, okay, have your pizza, but then have, a bowl of steamed broccoli, or have a really good nutritious salad with like cabbage and pumpkin seeds and kale or something like that. Or have your pizza with a side of sweet potatoes and roasted cauliflower. Just always making sure you're adding more fruits and vegetables is huge. And then fish. So fish is good for inflammation. It's an anti-inflammatory. I'll talk about fish oil in a little bit. So that would be a good thing to add into the diet. Having lean protein is really important. So lean chicken, turkey, lots of nuts and seeds. That's going to get you some healthy fats, which are good for brain health, which are good for your joints. Healthy fats are really important for supporting the joints and just making things more softer, and helping your hair and skin and nails. So that's a really important thing to get into. So you can have like almonds, walnuts, pumpkin seeds, sesame seeds, cashews. All of those things are helpful. Other healthy fats would be things like avocado, which I've talked about before, olive oil, coconut yogurt, or Greek yogurt. So that's kind of like an anti-inflammatory diet. It really is focused around having a lot of fruits and vegetables, healthy fats, nuts and seeds and legumes, and then lean protein. And then you want to have less of or avoid things like really processed foods, so things that come in cans or things that are prepackaged, so cookies and sweets, really salty foods, so whether that be chips or cold cuts. Oils that can be really inflammatory are things like canola oils and certain vegetable oils. Those can be also inflammatory too, so go towards more of an avocado oil or an olive oil. And then also a lot of red meat, a lot of dairy, those can be inflammatory too. So having less of those, trying to avoid those. Maybe a good idea would be having one day a week where you're completely plant-based. So even for breakfast, lunch, and dinner, try to be completely plant-based one time a week. And that way, you know for sure you're going to be getting in a lot of healthy anti-inflammatory foods. Okay, and then the other thing with the diet and exercise is it also helps with healthy weight and helping to maintain a healthy weight, because excess weight or too much weight can put more strain on the joints. It's more weight on your joints, so it can put more pain or swelling on the joints. So that's kind of another just benefit of having an overall healthy diet too. All right. So any questions about diet, about movement? I'm going to read the comments and then we'll go on to the next one. Okay, do you think that maybe exposure to certain activities, jumping, which cause pain or discomfort because we may not be used to it, can be an indication that we should partake in the activity more? It depends, and I would say it depends on your activity level and your age and your condition. So if you have arthritis, I would say probably not the best thing to do, regardless of if you think that it might be an indication to do it more. I would say it's probably not. If you're younger, if you have no aches and pains, if you have no conditions, then potentially it could be because you could be doing something and then feel a little bit sore. And again, you should know the difference between soreness and pain. If you do something and you're in pain, you probably shouldn't do it again. If you're doing something like you go for a long run, or if you play basketball and you're jumping a lot, or if you play soccer and you're doing a lot of kicking and pivoting, and then you feel a little bit achy and sore the next day, then that's probably okay. You can recover and then do it again, but maybe do it at a little bit of a lower intensity. Same thing with the jumping. If you're doing squat jumps and you're a little bit sore the next day, or if you're feeling a little bit achy, then maybe you just need to give yourself more time to recover and you need to go into it a little bit slower. So I would say just knowing what is, like you said, both pain and discomfort. So if it's really painful and it's really uncomfortable and it's you would rate it as a high intensity, then I would say to not do it, especially if you have arthritis. But if it's if you're overall generally you have no conditions and you're fairly healthy and it's just causing a little bit of achiness, then that's okay. Okay, often as the more we do it, the more body can able to handle it. Yes, but not necessarily, again, for if you have joint pain. It's probably going to be putting more strain on your arthritis and your joints than giving you any benefit. Yes, and just like with any other activity, sport. Yeah, so like I said, sports, again, you have to be careful. Like if you're constantly going for, running marathons too, that can be a lot of strain on your joints. So like just knowing where your fitness level is at too. So yeah, so on a case-by-case basis, exactly. So if you're generally, pretty healthy, you don't have any arthritis, then I would say yes, but sometimes we might not push ourselves hard enough to see the difference we want to feel. Again, like knowing just what is tolerable for you what you can do to see results, but again, you don't want to be in pain. So if I'm going for a run and I'm, want to push myself to go a bit further and I know I can do it and I'm not in pain, then I should get, it's always in your mind that you want to stop, but maybe you can keep going. But if I'm doing it and like my knees are hurting and I'm in a lot of pain, it's probably better if I stop and then just reassess the next day. Okay, so do carbs increase inflammation? So there are certain carbohydrates, like those refined carbohydrates, so things like white bread, even things like white rice where they're stripped of their natural fiber, carbohydrates, or even things like sugars, so those are carbohydrates. Yes, those can spike inflammation and increase inflammation in the body. So anything that's been stripped of its natural form. However, carbohydrates are also vegetables, so vegetables are carbohydrates. So something like a sweet potato or a regular potato, or a nice brown rice, or like a legume-based pasta, so like a lentil pasta. Those kind of things are carbohydrates that shouldn't spike inflammation because they are whole grains, they have more fiber. Fiber is actually helpful for decreasing inflammation, and they provide us with more nutrition, and they're not as high in sugar, like the sugar content. So if you want to have more of those types of things, so less of the white breads and the white rice and the cookies, and more of the like whole grains would be better. Okay, so sometimes we can push ourselves too hard when we burn out. Exactly. So you have to find the right balance of knowing, like, okay, that's what I kind of talked about in my how to start working out video. I talked about the importance of starting something slowly, knowing what you can do, what's attainable for you, and then having a workout routine based on that. So if you haven't done something in months, don't go and do a 2-hour workout or even a 1-hour workout. Maybe you have to start with 10 minutes. My mom has arthritis and so do my sister and I. So is arthritis hereditary? So arthritis can be hereditary. It's not necessarily genetic, like there's not necessarily a gene for it, but it can run in the family, and if you have it, maybe somebody in the family is more likely to have it. It doesn't necessarily mean that they will get it. So yes, it can run in the family, like many other conditions do, like high blood pressure can, be hereditary, other things too. So yeah. All right, I'm going to jump into number 3, which is fish oil. Yes, omega-3 fish oil. So I've talked about fish oil before, and it's really great because it is an anti-inflammatory. So it helps to reduce inflammation in the body, and it also helps to support the joint tissue by reducing that inflammation. Gives you a nice, healthy inflammatory response, because as I mentioned before, a little bit of inflammation is normal for the body, but when it's that chronic inflammation, that's when there's a problem. So fish oil helps to regulate a healthy immune and inflammatory response. There's different forms of fish oil. There's different sources of fish oil. So you have to know what you're getting, making sure you're getting a good quality fish oil. So something that is third-party tested, which means that another company, so it's sent to an external company to do the testing, is important. It's usually the quality of the fish can be standardized by certain companies, or there's certain ways of grading it too. So just making sure that you're getting something that is a good quality one. Like I mentioned before, I think I was talking about dosing. So around 2,000 milligrams of fish oil a day is usually like a standard or typical dose, and you have fish oil is in different forms, or different kinds of fish oil, so, or omega-3s actually I should say. So there's like your EPA and your DHA, and that's usually what you'll see, and you'll see that in the fish oil if you read it. So it should be about a 2-to-1 ratio of EPA to DHA. So EPA should be higher. It actually could be even higher. It could be like a 3-to-1 ratio, or it can go even higher than that too. So that would be indicated of a good quality one, and a good ratio. And this is typically from like sardines or anchovies are where they usually source it from. If you want to have it in what's it called, food form, then you can get it from food. So things like salmon, anchovies, sardines, mackerel, herring are good sources of fish oil. Other sources of omega-3s can be things like flax seeds and chia seeds and hemp seeds. Your nuts and seeds would give you it, but it's usually not as potent. So usually you have to consume quite a bit of fish in order to get that amount of that's in the supplements. And when you're having the supplement, you can either have it in like a liquid form or a capsule form. Okay, so let me know if you have any fish oil questions, and then I'll move on. Somebody mentioned krill. So krill is also, yes, the type of fish oil. There's also cod liver oil. Cod liver oil is also high in vitamin A and vitamin D. So just be careful how much you're taking of that, because you don't want to take too much of those vitamins. Okay. Yes. So when there is inflammation in the body, then that can turn into symptoms of swelling and pain. So that's why I kind of talk about having that anti-inflammatory, because when you reduce inflammation, you're going to then reduce swelling and pain. And that's usually what is the big trigger in a lot of joint issues and arthritis and stuff. And just in general. So if you don't have arthritis, but if you have joint pain, if you get headaches, if you get aches and pains, then these are still some good things to take. Okay, so the next ones are going to be ginger and turmeric. They're very similar. I'll go into ginger first. So ginger, I'm sure we know of ginger. I've talked about it before, and I'm sure you've heard of ginger before. It's a typical herb used in cooking. So the root of ginger is actually used. So both ginger and turmeric are roots, and they look very similar. So ginger, you can get it either in like a capsule form, you can get it in a chewable form, or you can also have it through the food form. So you can have it either like raw, you can have it in like a juice or a smoothie raw, and it's pretty strong, or you can grate it or chop it up and have it cooked either in a stir fry, or you can bake it in the oven with covered it with vegetables and stuff too. So those are just different ways of consuming ginger. With ginger in a capsule form, they can range. Usually one capsule contains around 250 milligrams of ginger, but you can have that, or you can even have more depending on your condition, what you can tolerate, what other symptoms you have, what other medications you're on. It's always important to talk with a healthcare provider before starting any of these supplements that I'm talking about, because they can interact with medications, they can interact with other supplements. So it's always important to check with your healthcare provider before starting any of these. Okay, so ginger is anti-inflammatory and antioxidant. So it inhibits something called COX-2. So if you were to look that up, that is what can cause inflammation. So basically it forms these things called prostaglandins, and then prostaglandins are what cause inflammation in the body. So it actually works like NSAIDs. NSAIDs are things like, they're non-steroidal anti-inflammatory drugs. So things like Advil, aspirin, what's the other one called? Celecoxib. Those ones are anti-inflammatories, and ginger actually works like that because it inhibits the COX-2, which is what the NSAIDs work on too. However, it doesn't really cause GI side effects like the NSAIDs might, and that's because it's pretty selective. So that's kind of the mechanism behind ginger and why it's really important for reducing inflammation, for reducing pain. I've talked about it before in the sense that it can help with migraines and it can help with period pain, but it can also really help with arthritis and that pain and joint pain due to arthritis, and help with the swelling. So that's a good one. I'm going to go into turmeric now, and then I'll answer questions about those. So turmeric is from the plant called curcuma longa, or curcumin. So uh, turmeric has that active compound called curcumin, and that's what is the effective anti-inflammatory component of it. So it's good for helping with managing joint pain and arthritis, and it has little side effects. So it is similar to, again, to the NSAIDs like ginger is. Just this one, you might want to be a bit careful with high doses. It can interact with other medications, so it can interact with supplements like iron. And if at really high doses or even higher doses, it can cause acid reflux or can be a little bit irritating on the esophagus. So just being, again, knowing what a proper dose is or how much you should take. Typically a dose is around 500 milligrams, but again, just being careful with anything that you start or that you take. But again, this is a good one too. Like ginger, they're both great for reducing inflammation. They can both be used in cooking. So turmeric, you can use the turmeric powder or you can take capsules. Adding it into the diet is helpful. Of course, it's not as a therapeutic dose as you would get in a capsule form because you would have to take so much in your food, but it's still helpful for adding it to food to help, reduce some inflammation. You might see it with black pepper in the capsules, and that's because, or even in liquid form, and that's because it can help absorb it. So that's something to add to. Okay, so let me know if you have any questions about that before we move on to number 6. Is there a supplement pill that contains ginger and turmeric? Not that I'm aware of, but there might be. Because there are some that contain turmeric and some of the other like anti-inflammatory supplements too, but I'm not too sure if there's one with both. And sometimes there's ones that have both, but then they might have lower lower levels of both because you're going to be getting that synergistic response. So when you have like 2 things or 3 herbs that do the same thing, the more of them together give you a higher response of that, so you don't need as high of a dose of them. But let me see if there's anything that I can find. I think, yes, so there is some, there's Joint Pro, it's called, by Camprav, which is a pretty decent company, and it has a lot of stuff in it though. Does it have turmeric? I thought I saw it. Ginger. Yes, it does have curcumin. So it has a lot in it. So that one's Joint Pro. I can write it down. Joint Pro. So that one does have some. I am not sponsored by any of these that I'm talking about. So yes, but again, like it has a lot, some of these combinations have a lot in it. So deciding like what's best for you, if you should have a combination of something or if you should try something an individual, to experiment with that, if that's best for you, or always asking your healthcare provider to see what's the best one. Is it better to take a multivitamin or supplements separately? So yeah, I kind of just said that, like, it depends. Sometimes when you're taking a multivitamin, you have to look are these therapeutic doses, are they, or when they're like combined together, are you going to get a higher enough dose? Sometimes it's better. I personally like just taking them separately and getting a therapeutic dose that way, maybe taking 1 or 2. So something like ginger and turmeric, maybe just choosing one of those. And then choosing your fish oil because they're a little bit different. They have different benefits. So sometimes it's better to take them separately, but sometimes for the ease of taking things, you might like taking one thing together and it might work. Is it always better to get it the natural rather than pill? Yeah, so of course getting it from foods, your diet is the best way of getting things because it is the most natural. It's not been, through a lab and in a pill form. But sometimes we can't, like I said, get that therapeutic dose. We'd have to eat so much fish. We'd have to have so much turmeric. We'd have to have so much pineapple, which is, I'm going to be talking about that one in a bit. So sometimes you have to take it in the supplement form for a short amount of time to help manage your symptoms and get pain under control. And then you can go back to always having a proper and healthy diet is so important. What about calcium pills? So calcium and vitamin D together. So, don't ever take it alone, because with the vitamin D, that helps bring it into the bone. And even with vitamin K2 and magnesium. So those ones together are good for helping with bone health. Not necessarily going to really decrease inflammation or decrease arthritis pain, but it's helpful for bone health. So those are good ones. And more so, those would be better for like osteoporosis. So osteoporosis is when you have bone loss. As you get older, that can happen. And it's more common to happen after drops in estrogen too. So yes, having calcium would be helpful with vitamin D and magnesium and vitamin K2 for helping with bone health. Okay, let's move on into number 6, which is boswellia. So I'm not sure if any of you have heard of boswellia, but I'm sure you've heard of frankincense. So boswellia is actually Indian frankincense. Boswellia is its Latin name. So this one is actually really great for helping with joint pain and inflammation. They take like the resin of boswellia. So the resin is like, it's a sticky kind of gummy substance of the plant, and then that is used, and that can be used in capsule forms, usually around 200 milligrams a day, or you just do it as directed on the supplement. So what it has in it is boswellic acid, and that is what has the anti-inflammatory components. It helps to prevent inflammation in the body by helping to prevent leukotrienes, which are things that cause inflammation. So I talked about before prostaglandins, and now I'm talking about leukotrienes. So these are just big words, which are things that happen in the body that can cause inflammation. So the boswellia, the boswellic acid is what can help decrease this. So that's kind of how it works for inflammation. So yeah, this one is a herbal remedy that can be helpful for reducing inflammation. It can be, in some of the inflammation supplements, like combination ones, it's usually in there. You can also find it alone, but yeah, that one's a good one too. Okay, now I'm going to go on to number 7, which is bromelain. And bromelain is, remember I was talking about pineapple? Well, this is an enzyme that is derived from the pineapple plant. So even if you ate a lot of pineapple, it's really hard to get the therapeutic doses of this. So again, if you need to have it in a supplement form for a short amount of time to help get your symptoms under control, then that's okay. So this one can help to reduce muscle soreness and muscle aches. Of course, it's an anti-inflammatory, because that's what the main theme here today is. And it's also an analgesic, which just means it can help to reduce pain. It's really helpful for like soft tissue pain, for swelling, for joint stiffness of osteoarthritis. So it's good for helping reduce all of those. It is an enzyme, so it is also helpful for other things like digestive issues. It's also helpful for asthma and respiratory conditions too. This one, again, the ranges of the dose, like the studies on it, vary from around like 500 milligrams a day up to 1,500 milligrams a day. It can be taken in pill or tablet form. But yeah, it is a good one to help. And sometimes it's nice when something can have many different properties. So usually when I'm like looking at a case for a patient or a treatment plan, if they have a couple of conditions, if one thing can help those different conditions, because that's the great thing about plants and enzymes and minerals, they help different things because they have so many different properties to them. So for example, if you have asthma and you have arthritis, then maybe something like bromelain is a good one to take because it can help two things. Okay, before I go into the next 3, does anybody have any questions about the boswellia or the bromelain. And again, a lot of things that I'm talking about today are going to be a little bit repetitive because we're talking about the anti-inflammatory aspect, but they're all have different properties. And like I said, knowing if there's any other symptoms that you have. So for example, ginger is helpful for nausea. Like I said, it's also helpful for migraine, so maybe that's a good option for you. Fish oil is a pretty good standard option. It's helpful for cardiovascular health, so your heart health. That's a good one to take there too. So yeah, many of these things have different properties and different benefits to them. So that's why it's all really helpful to take what is best for you and looking at what's best for you. Okay, so where can I buy them? So many for me to take, exactly. So just, pick what's best for you. Like I said, look at which one do you think can target your symptoms the best, or maybe trying things out and seeing which one works for you. You also have to give things time. It's not as fast sometimes as conventional medication can be. It might take some more time to work, especially with the fish oil. It would take some time. Ginger's pretty quick. It can help with reducing pain pretty quickly, but some things will take some time. And you can buy them at any health food store or supplement store. You can buy them online. A lot of places online have them too. Okay, let's go into magnesium. So this one is more so helpful for preventing like the wear and tear on the joints or reducing the intensity of arthritis. So actually a deficiency of magnesium can increase the chances of having a worsening or a progression of arthritis. So that can be a risk factor for development of osteoarthritis or osteoarthritis progression. So it's really important for our bone health, for our overall immune system. It's an antioxidant. It's good for nerve cells too. It's just an abundant mineral in our body. It's also important for heart health. So for blood pressure, it regulates all these things. So it's really good mineral to take, and we can get it from food quite a bit. So you might not need to supplement in it, but a lot of us don't have as much of these types of foods that we should, or that we don't have this in the standard American diet or the Canadian diet as much. So this is things like your dark leafy greens, things like almonds, what else? Things like nuts, so cashews and pumpkin seeds and sesame seeds, things like oats. It's also in some yogurt, but really in the greens and the nuts and the seeds is where it's a lot in. So if you don't have a lot of that in your diet, then it's probably best if you supplement with magnesium. And it's a fairly easy, tolerable supplement with really minimal side effects. You have to know which form to get. So in terms of joint pain and bone pain and arthritis, the one that's been studied is magnesium glycinate. That's the one that's best for joint pain. It helps to reduce chronic pain. It helps to reduce inflammation and improves muscle flexibility and bone health. So if you're going to get that one, it's magnesium glycinate. Because there's other ones. There's taurate, there's citrate. They all have different effects on the body. So that's important too, to know which form to get. There's different forms of vitamins and minerals and supplement stuff. So magnesium glycinate is this one. In terms of, dosage, so they typically range around, one capsule usually has around 150 to 200 milligrams. So you can start with that and see how you tolerate that. It also helps for muscle recovery, muscle pain. So even if you don't have arthritis and you just work out regularly and you want or if you feel like you have muscle spasms or restless legs or just stiffness, it's a good one to take. It can really help calm you down. It's good to take it at night. It can help with a nice restful sleep too. Okay. Then number 9 is topicals. So this is things that you can apply topically, and topicals can be really effective. There's even studies on for conventional medicine. There's even studies on topical NSAIDs being just as effective as oral NSAIDs, and they have less of the side effects. So same thing with topical natural remedies. You can try those out and see how they help, and see if they help to reduce pain or swelling. They're not going to work like an internal one does, but if your pain is minimal and you want something with even like less side effects and less of a systemic effect, you can try topicals. So this would be something like an arnica gel. That one is good for pain, bruising, for like even after surgery or fractures. It's a really good one to take, and that's from the plant. There's capsaicin, and this is from peppers. This one actually helps to reduce something called substance P in the body, and substance P, like the letter P, this one is what can cause pain or have that pain response. So capsaicin can help reduce this. It is like a little hot, and it might be a little bit stinging on the skin, so you can always like patch test to see how you handle it, but it's a good one to reduce pain in the joints. And then another one is castor oil. So castor oil is like a really thick oil. This one can help reduce inflammation and pain, so it's a good one too. It can be applied really anywhere that you experience pain. So those are some good topicals. Okay, so before I go into number 10, let's see if we have any questions. So CBD oil topically for arthritis. I'm not too sure like on CBD oil. I know it's a fairly new thing in terms of research and stuff. So I'm not entirely sure, but I think like just from what I've heard from some people, that it can be helpful for pain because of the way that it works on the cannabinoid system in our body. But I can't give you a definite answer if it is, studied to show that it is helpful. I don't know if there's actual studies on it, whereas some of these other things that they are. Okay. Let me know if you have any questions about that, and I will talk about physical therapy and then wrap it up. So physical therapy is always an important part to have of your treatment plan. And I left it as number 10, but it doesn't mean it's the last one or the least important. It is actually probably the most important one, and this is seeing somebody, like some type of physical therapist, whether that be acupuncturist, chiropractor, physiotherapist, massage, naturopathic, somebody that can help actually work on the joints. And maybe you need to see a few of these practitioners because they all do different things and they all have their own modalities that's helpful and important. So getting assessed by, whether it be one of them or maybe one that like a group of them that work together to see what would be the best option for you is really helpful. They have different types of machines, like a TENS machine and ultrasound machines. The acupuncture needles can be used, and that helps reduce local inflammation and increases circulation to the area. They can do mobilization that you wouldn't be able to do on your own, so helping with stretching and strengthening of your joints. It's really important in order to get like a good assessment and get an overall picture. And that can, like I was talking about before with the exercises, some of them can also help out with knowing what the important exercises are doing in proper form. So physical therapy is a good one to add to your routine or your whatever protocol you want to do for yourself. It's always good to have that person, like an outsider's opinion, and having somebody to provide you with actual therapy. Okay, so we'll take the next few minutes to answer questions, and while you guys are writing up any questions that you have, let me just do a bit of a recap. Okay, so we chatted about number 1 was movement. So this was low impact things. If you can do some sort of swimming or cycling, yoga and Tai Chi, those are great movements to help just also increase strength and flexibility and then reduce the impact on the joint. Then we talked about number 2 was the anti-inflammatory diet. This is so important for helping working like inside out. Like everything that we eat is so important. It's fuel for us, but it also really affects our overall health. So having a good diet is the foundation for any type of treatment plan. And making sure you're having lots of colorful fruits and vegetables, minimize the amounts of red meat, the amounts of dairy, and then try to completely avoid anything really processed. Those are the worst things, and that's what can cause inflammation. Number 3 was fish oil. This one's really helpful for reducing inflammation in the body and helping supporting the joints. It's good, like I mentioned, for your heart health and your overall like cholesterol and body health too. So that's a good one to think about adding into your routine, and maybe having more fish in the diet, which is also helpful. Number 4 and 5 were ginger and turmeric. These are root vegetables or root plants that are helpful for reducing inflammation because of the mechanisms that they work on in the body. They help to kind of work like an NSAID in terms of reducing the COX, so by inhibiting that, COX2. So those are both really helpful anti-inflammatories. Then number 6 was boswellia, and this was the herb frankincense, and how I talked about this one in terms of reducing pain. Like it's that sticky resin that's extracted from the herb, and it can help in reducing pain and overall reducing inflammation. Number 7 was bromelain, and this one is the enzyme of the pineapple plant. This one's really helpful for reducing muscle soreness. It can also be helpful for other conditions like asthma. It was really good for stiffness too and joint pain. So that was that one. And then it's also helpful for digestion. Number 8 is magnesium. And magnesium is, like I said, a mineral that's abundant in the body. We get it a lot from like leafy greens and nuts and seeds, but it's helpful for just helping that muscle tone, for reducing inflammation, from even preventing the progression or the worsening of arthritis. It's also helpful for blood pressure too, for restlessness, for spasms, muscle spasms, and all that. So it's a good one. And then number 9 are the topical things, like I mentioned. There's many different ones, but I just mentioned a few. So that was arnica, capsaicin, and castor oil. And the number 10 is physical therapy. So adding in either, a few modalities or getting assessed by a physical therapist, so either acupuncture, chiropractic, massage, physio, naturopath, any of those is helpful. All right, so let's see if we have any questions, and then we'll wrap it up for today. Okay. Are women more prone to arthritis? Give me 1 second. So, if we look at the epidemiology of osteoarthritis, not much higher in women. It's 10% in men and 13% in women. So it's not much higher in women. Women actually have more prevalence of osteoporosis. So the one that I was talking about, the bone loss, the bone density loss, that's more common in women. But for osteoarthritis, it's fairly similar, a little bit higher, looks like in women. I wouldn't say there's any more risk factors that they have, like I mentioned for the osteoporosis, it's that decline in estrogen that happens after menopause. So anyone that goes through menopause and has that decline in estrogen, that's more common in that demographic. But for osteoarthritis, not necessarily. You can even get, usually it's as you get older, but sometimes it can even happen if you have injuries. If you have really bad injuries to your joints, then you can get arthritis from that too. Other than what you listed, is there anything one can do to prevent arthritis, like ballet or something, or yoga? Yeah, so it is like having just like the things I mentioned. So having magnesium in the diet, or making sure you're doing movement. But preventing things would be making sure you're not doing anything too strenuous that you can injure yourself, because repetitive injury on the joints can cause arthritis. So yes, making sure you're not doing something like that. So like I was talking about proper form, and when you're doing exercises, having proper form, because if you're not having proper form, or if you're constantly hurting your joints, that can make things worse. So it's like that wear and tear on the joints. Making sure you're wearing proper walking shoes, proper equipment, making sure you're staying hydrated. So water is important. It's important for the discs in our spine, and keeping like that fluidity around our joints. So those kind of things would be helpful for preventing or worsening it. Does texting cause arthritis? I'm not too sure, but I know when I text, I get pain in my thumb joint. So I would say it could probably, again, any repetitive motion on your joints is not good for it. So taking a break from that. So I don't know if there's necessarily a correlation with, yes, texting causes arthritis, but it can probably, make a joint sore or irritated, or make something a little bit worse. So yeah. Okay. So next week I'm going to be talking about cravings, so food cravings, and how to help manage cravings, and then like some ideas for some more healthier snacks, because we had a little request about that, kind of with some, how can we make more like healthier snacks, or how do we know when we're full. So I'll be talking about that, like the whole like food eating response, hunger response mechanism, and kind of how we can manage our cravings, or what we can do, and I can give you some health tips for that. So yeah, all right. I hope you all enjoyed today. I hope you learned something, and hope you found it helpful. Let me know if you like the new style with the visual, and I can do that again next week and keep up with that. If you have any suggestions for future content, please feel free to add it in there in the comment box. And subscribe, like this video. Thank you so much for always participating and joining me every Friday and chatting about different health topics. Let your family and friends know so we can have more people, because the more questions we get, it's more helpful, because other people will have, probably have similar questions to you. So yeah, thank you all for coming, and I hope you all have a wonderful weekend, and I'll see you all next week. Have a great day. Bye.